My name is Sharon.
Hello, Sharon.
I am a student nurse at South University. And what's your name?
Lorraine Young.
Okay. And what's your date of birth?
26066.
Oh, okay. Wonderful. All right. I'm going to go wash my hands before I start with you. Okay. Are you allergic to anything, Lorraine?
Not that I know of.
No medications?
No, ma'am.
No dust or pollens? No,
No.
food?
No.
Okay.
I like
Good.
food.
Oh, good job. All right. And so, as you can see, Lorraine appears today in well-fitting clothing. Okay, it's very nice and comfortable for the weather, and she's dressed so appropriately. She speaks very fluently. Lorraine is alert and oriented to situations. She knows why she's here today. All right. And before she came in the room, we did some vital signs on her, and her vital signs are normal. And her blood pressure was 110/60, and her pulse was 78, and her respiration is 16, and her temperature is 98.4, and her oxygen saturation is 99% on room air. Her weight is 116 pounds, and her height is 5 feet 6 inches, and her BMI is 20. All right. So now we're going to do a skin check on Lorraine, just to make sure overall that her skin is intact and there's no issues with her skin. Okay. And so I'm just looking and inspecting, and as I can see that her skin is nice and intact right now. There's no lesions, no bruisings. Okay, good job. And now I'm going to go ahead and I'm going to inspect Lorraine's head and her scalp. Okay, and just make sure I look at her face and there's no deformities or anything. And I'm going to look at her head and there's no deformity. It looks like it's just intact. We're going to go ahead and check her scalp, and we're just going to make sure that there is no tenderness. Just let me know if you find if you feel any tenderness, or if it hurts, or if anything. Okay.
No.
All right. We're going to check in for sores. We're checking for softness, texture, when the hair is evenly distributed. Okay, and there's no lump, no dry scalp, no mitts, and no lice or anything like that. Okay. Also, we're going to check her temporal pulse, bilateral. Okay, and it's going to be right here. Okay, so I'm going to check sensation, facial sensation, and check for temperature. Okay, nice and warm. Okay, Lorraine, I'm going to use a sharp object and a dull object, and you let me know which is sharp when it's sharp and when it's dull. Okay, just say sharp, dull, okay?
Don't close my eyes.
No, you can open your eye.
Sharp.
Let me
Dull.
know.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay, so Lorraine has good facial sensation. Okay, so now I'm going to ask Lorraine now to open her jaw again, and I'm going to put resistant. Okay, good. All right, and then you're going to you can open your eyes, Lorraine, and look at me, and then you can do your jaw like this, back and forth. Make sure we're checking to make sure that cranial number 5 and number 7 is intact. Okay, and now I'm going to ask Lorraine to clench her teeth. Okay, good. And I'm going to ask her to open her mouth. Okay, and I'm going to check for cranial nerve number 10 for the gag reflex, and I'm also going to do the cranial nerve number 9 while I'm there. Okay, so say ah. Oh, good. And the uvula is in line, midline, and I'm going to stick your tongue out for me. Good. Leg it to the left or to the side. Okay, and her mouth is nice and pink, oral mucosa, and her lips are nice and pink. Okay, no dryness or anything like that. All right, so now we're going to gag reflex. So I'm going to ask you to take a sip of water, and then don't swallow until I say swallow. I'm going to hold your head back and then just swallow for me. Good. And then she has good swallowing reflexes and no gagging, or no, she wasn't choking or anything on her. Raise your eyebrows for me, Lorraine. Okay, up and down. This is cranial nerve number 7, and we had already asked her to smile for me, please. Everything is nice and symmetry, and there's no everything looks good. Okay, all right. So also we're going to go ahead now, and we're going to check your optic nerve. All right, and like I said, Lorraine did have a vision test before she we checked before she came in, and we did the Snell chart, and we also did the eye cover test, and it showed that she was 20/20 vision. Okay, there was no vision loss. All right, so now I'm gonna ask you to follow my hands, and I want you to follow in every direction, but do not move your head. Okay? Okay, and we're checking. Okay, good. So we checked cranial nerve number 3 and cranial nerve number 2 and 3. Okay. Also, we're gonna check for in her eyes. We're gonna check to see if there's any inflammation, any redness, any yellow, any drainage or discharge, any nystagmus or any drooping of the eyes. There's none. Okay, and everything looks good. Color looks good. And we're gonna, while we're here, we're gonna go ahead and check for her pupil check. I'm gonna go ahead and turn off the light. Okay. So dim that light and turn this light off. Oh wow. There we go. All right. Good. Good job. Okay. So just so that we can see, so turn the light back on. And pupils are equal, reactive to light and accommodation. Okay. All right. All right. So we're gonna check our ears, cranial nerve number 8. And that's the oscuscus nerve, okay? And we're gonna do a whisper test, and we're gonna also do, I'm gonna ask you to let me know. I've already checked her ear for any form of sores or any form of deformities, and everything looks great, all right? And she was able to feel me, all right? So now I'm gonna, let me know when you hear my fingers rubbing together. Are you hearing it? Okay, good. All right, and I'm gonna whisper, and you tell me what I say.
1, 2, 3, 4, 5, 6.
Okay, and so as you could tell that Lorraine was able to hear me quite well. And now we're gonna do the otoscope. We're gonna check for her ear, inner ear. We're gonna check for any bulging of the tympanic membrane or any redness or cerumen buildup. Okay, and it looks good, no redness. We just have a little bit of cerumen. Okay, no redness, no perforation, and just a little bit of cerumen buildup. Okay, now we're gonna ask Lorraine. I'm gonna open this up and ask her to smell it. This is, hopefully she can smell it. Tell me what's that you smell?
Alcohol.
Alcohol. Wonderful. Perfect. All right, so that's olfactory nerve number 1. Okay, and she was able to smell. All right, so we're gonna check your nose. Fan your nose for me, please. Oh, wonderful. All right, and we're gonna look up inside her nose. Just make sure our turbines are good and there's no deviation. Okay, nice and good. No redness, no bulging, no sores, and everything looks good. No deviation. Debia deceptor. Okay, now we're gonna check inside. We did check the inside of her mouth already, so now we're going to go ahead and check the frontal sinuses. We're going to go up on the brows. Let me know if you feel any tenderness.
No.
Okay. Any tenderness?
No.
Okay. And the maxillary sinuses. All right. Nothing. And also we're going to check on the preauricular lymph node while I'm at it on her face. And I'm going to check the pulse. Okay, and no nodules, no lumps or extra lumps or bulging is noted. We're going to go up on the submandible, submental. Okay, we're going to go on the anterior surface. Okay, nothing. We're going to go on the posterior. We're going to go at the occipital. Okay. All right. And now we're going to go on that. Okay. This is the supraclavicular and this is the infraclavicular. Okay. And the lymph node should be pea-sized, mobile, and also non-tender. And you didn't feel any form of tenderness.
No.
Okay. All right, so we're going to check our carotid artery, okay, and we're just going to do one carotid at a time. We don't want to do both of them at a time because we don't want to cut off any form of circulation or hair. Wait, okay, and none. All right, so we're going to do your neck rotation from side to side. Flex your neck for me, please. Let me know if you have any pain, any tenderness, or anything.
No.
All right. And so, all right. So, okay, good. All right. So then now we're gonna check for your shoulder. You're gonna raise up your shoulder against my hand for me, please. Okay, good. And you lift up your hand just a little bit. You don't have to lift all the way. I want to check for your axillary lymph node. Okay. Lateral, central, pectoral lymph node. Okay. All right. So we're gonna check the range of motion. All right. You're gonna put your arm up. Then you're gonna we're gonna pronation, supination. Wiggle your wrist for me, please. Gonna bring your elbow in, elbow in. Okay, then you're gonna raise your arm above your head and down. Raise your arm above your head and down. And we see any restriction, any pain, any issues. Okay, and we can see that Lorraine did not have any pain with her shoulder movement, no deformities, no tenderness or anything like that. All right, so I'm gonna go ahead and check Lorraine's brachial pulse. Okay, good. And radial, which is good. Okay, I'm gonna check the other arm. That's good. Okay, good. Now can you grip my finger, please? We're gonna check our grip strength. Good, squeeze it pretty good. Oh, okay, good. Grip strength is pretty good, and it is 5 out of 5. Okay, and now we're gonna do our anterior chest. We're gonna auscultate our lung sound, and we're also gonna check for our heart valve. Okay, so first of all, I'm going to do the lung sound first, and then I can do the heart valve. Okay. All right. I want you to take a deep breath for me, Lorraine. When you breathe in, out into the mouth, out into the nose, out to the mouth. Thank you. Breathe. And for this video, Lorraine differed from taking off her shirt in this video, so I'm not able to, just so you know that normally I would check the whole anterior chest, but because she differed and I didn't want to hear a different breath sound, so I didn't want to go too far with that. But we're going to go ahead and we're going to check her valve when she lays down, so we can check that later. All right, so I'm going to go to your back, and I'm going to check the posterior part of your back, okay? Also, Lorraine, it differs for us to do the breast test, breast examination. Okay, so we're listening for the lung sound. I want you to take a deep breath for me too. In through the nose, out to the mouth. Okay. Okay, thank you. That was good. There was no adventitious breath sounds noted, no rhonchi, no rales, no wheezings, no echophony sounds or bronchoechophony sounds. Now we're going to do tactile thermometers, and Lorraine, when you feel me touch you, I want you to say 99, okay? Every time I touch you, okay?
99, 99, 99, 99.
Okay, good job. All right, so I'm going to also check Lorraine's kidney just to make sure that her kidneys there's no infection or no inflammation in her kidney. So I'm going to go ahead and I'm going to do our costibiovertebral angle tenderness, CVA, and it's going to be right at T12 and between the spinal column here. All right, so I'm going to, when I thump my hand against your body, let me know if it's tender, okay?
No. No.
Okay. All right, so there is no tenderness or anything like that. All right, so now I'm going to check Lorraine's abdomen, all right? So I'm going to ask you to turn over. You're going to lay down for me. Okay, good. So there you go. All right, so and with her abdomen, first I'm going to make sure that I check her abdomen for any form of distension, any form of bumps, lumps, or any raised areas, or anything, any extra pulsation or anything like that. And so far, even contour and its symmetry, there's no abnormalities right there. Okay, so also I'm going to check her heart, her heart valves. Okay, and this I'm going to check for her aorta. I'm going to check the pulmonic. I'm going to check the tricuspid and the mitral valve, and the apex, and the PMI, and that's where point of maximum impulse, and that's where you hear the loudest. Okay. I'm also going to check also her renal arteries while I'm there. Okay. And like I said, you will for the abdomen, you will do inspection, auscultation, percussion, and then palpation. Okay. So we're going to check for the renal artery. We check the aorta valve, and we're going to check the right iliac valve. We're going to check the left iliac valve. We're going to check the right femoral valve. We're also going to check the left femoral valve. We're going to make sure that we're using the belt of the stethoscope and not the diaphragm. Checking for Burritt. Over all 4 quadrants. Okay, listening for any tympani or any dullness. And also I'm going to percuss the area of the liver and just check. Okay, and listen for any dullness along the margin. And this is the area of dullness right here. And normally I would displace the breast, but like I said, Lorraine did not want it to come out of her clothing, so I'm going to do the best I can. And right here, and her liver span should be between 6 and 12 centimeters. Okay, so now that I've done that, while I have your hand here, I'm going to go ahead and just check for I'm going to check for your capillary refills. And I'm going to check for, okay, this nice and brisk with less than 3 seconds. All right, so now I'm going to check also check to see if Lorraine has any abdominal pain, any pain or any tenderness in your abdominal area?
No.
Okay, what I'm going to do, I'm going to push, palpate your stomach, okay, and let me know if there's any tenderness. And I'm going to palpate all 4 quadrants. Any pain?
No.
Okay. And her bladder? Okay, and like I said, she emptied her bladder before, so there's no. All right, and so now I'm going to go ahead and I'm going to check her ptosis sign, just to see if there's any tenderness into her lower right abdominal quadrant. All right, so put up your leg against my, okay, good. All right, put it down. No, just lift it straight up for me. Okay, feel the resistance. Okay, it's down. Okay, now we're going to check the abducer sign. We're going to bring the leg up. And we're going to turn it, rotate it internally, and let me know if you have any pain anywhere. Okay, any pain?
No.
Okay, good. The abducer sign is good, and our ptosis sign is good. Okay, now we're gonna have you sit up. Now we're gonna check. Okay, so now I'm gonna check flexion and extension of her knee. Now, Lorraine, I would like you to stick your knee out and in. Okay, and for the other one too. Any pain, any tenderness?
No.
Okay, there's no deformity, and they move well. Okay, and so do another movement for me with you. Good. Want to feel the kneecap, any tenderness?
No.
Okay. All right. And I'm going to go ahead and check your dorsal pedalis pulse. Okay, dorsal on both sides. And then I'm going to check your tibial, post-tibial. Okay. Okay. And they're palpable. There's no swelling, no edema in her legs. Okay, push up against my hand. Okay, push down against my hand. Push up against my hand. Push down against my hand. Okay, I'm going to check your Babinski sign.
Ouch.
Oh,
Tickles.
I'm sorry. All right.
Tickles.
I should see, you should see her toes flex, and for, yes, for kids it will fan, and for adults it flex, okay, and it did that. Alright, so now I'm going to go ahead and I'm going to check her, we're going to check her anterior drawers maneuver, okay, and that's checking for the anterior cruciate ligament, make sure that it's stable. Alright, I'm going to push up. I don't know if you can see me, but I'm going to go ahead and do it. I'm going to push up against it, okay, and there's no form of instability seen. I'm going to push up. You shouldn't see any form of instability within the knee area, okay. I mean, our anterior cruciate ligament is intact. Alright, so what I'm going to do next, I'm going to go ahead and I'm going to palpate her pulse, back of her knee, okay. And then, okay, let me read that one. Okay, and now we're gonna check the ankle. Can you rotate the ankle? Like it feel for me? Any pain or any tenderness or anything like that?
No.
Okay, and you can feel me good sensation down here?
Yeah.
Press up against my hand, please. Okay, good. Press down. Okay, press up against my hand. Press down. Okay. You feel me touching your toes?
Yes.
Okay. Alright, so what I'm going to ask you to do, wonderful. Now I'm going to do a neurological test on you, and I'm going to go ahead and do deep tendon reflexes, okay?
Okay.
I'm going to do your bicep area first, and then your triceps, okay?
Okay.
The biceps, you're going to just relax your arm for me, nice and relaxed. Just relax, no reason. Okay, good. Okay, good. Then we're going to check the back, relax. Okay. And then you see it contract a little bit there, so that's good. And relax. Okay. Good. And a little contraction. Okay, good. And so now we're going to do the brachial radialis, which is 2 to 3 centimeters above the radius. And check that. Okay. Good. And then our finger's contract just a little bit. Okay, and we should see for neurological testing, it should be 2 plus should be the normal. Okay, if it's 4, then it's clonic. 3, it is hyperreflexive, and 2 is normal, and 1 diminished, and 0 no reflex. All right, so now I'm gonna do your knees. Okay, patella. Okay, okay, good, and then. Okay, and so we did the Achilles here. I don't know if you can see me or not, but just stand up, please. All right, and I'm going to ask you to bend over, and I'm going to ask you to stand up. Okay, any pain anywhere?
No.
Okay, I'm going to ask you to walk over to the room there and tip your toes and on your heels and come back. And then do your heel. Okay, good. Any problems?
No.
Okay, so you just stand up. We're going to do the Rabunski sign. You're going to stand up with your eyes closed. And I'm looking for swaying. That's fine. You can turn, yeah. So I'm looking for swaying. Close your eyes tight. Okay, feet together. And she has good balance and no swaying. Okay? All right, Lorraine, you can have a seat. All right, and I thank you so much for letting me do this assessment and editorial on you today. Okay?
You're welcome.
Thank you for coming, and we'll see you again.
Okay. Thank
Okay.
you.